what actually can make us successful. That was the gap which Dr. Anand continues to talk, we continue to talk about, the skill, the training, the little knowledge a human being should have, but the doctor couple did not. So that's how this whole thing started, and we started looking for something, we like-minded people, and we first got in touch with my mentor, Raj, and we invited him to speak during the peak hours of terrorism, and he came to Jalandhar, where we had our 30-bedded pediatric hospital, and he came to Jalandhar to speak during those hours. And a fearless speech on how companies are dismantling our feeding practices. All the doctors sitting in the hall like this, they were just stunned that somebody can be that fearless. And from there we started working on organizing ourselves, joining people, how can we more and more into this area. But till that we were actually supporters of breastfeeding. We would even force a mother to adopt breastfeeding. Give her bottles. How let her? Why are you carrying a bottle in the clinic? I mean, these are the stories which we felt later. In '89, when he mentioned the first training, I got a letter saying, would you like to attend a training of 5 days on breastfeeding management? I said, yes. '89, I was traveling through Delhi, and I met a very senior friend in Delhi, a pediatrician. When I told him, where are you going? He said, I'm going for a training in Devlali, Maharashtra for 5 days. He started laughing at me. Breastfeeding for 5 days? And then he ridiculed me. He said, tell me when you come back, what happened? So 89, 90, we had another round of training. Rita joined that training, and we both learned the art of breastfeeding now. By the time children were grown, but we thought that we could help others. Then 91, this whole training of trainers took place, and the BPNI was born. And after that, this whole organizational setup, it was decided in Varda on 3rd December in front of, now this is the Kutia which Raj mentioned about, which is Kutia of Mahatma Gandhi in Sevagram. And then the first few days, or first few years of BPNI, we used to remain frustrated, and one day we're sitting in the clinic, quite frustrated and bored, and Raj appears from Bombay and gives me this plaque. Each work has to pass through 3 stages: ridicule, opposition, and then acceptance. I can only realize it now, after 20 years, they are so true. So friends, not that the ridicule is over. It's not. You get another idea, you get another ridicule. So keep on getting new ideas, keep on getting ridiculed. If you get ridiculed, mind you will get accepted. That is the theory behind this whole thing. That is what keeps us moving, and that's the whole personal level of BPNI when it was born. So this whole thing was, I touch upon the global movement which helped us move forward, the international code which Dr. Anand touched upon. The whole world was moving around the international code, and International Baby Food Action Network, called it FUN, was born in those years. And I must say that one of those persons, the 6 organizations who were Geneva, who founded it, FUN, and analysts sitting in the, could you just raise yourself? She has a broken leg, but she still thought that she should be here. She's the only person from that earlier 6th group who founded a fund in Geneva. When this question was raised, hey, you have made the code, who will monitor them? If companies are going to monitor themselves, companies are very happy that they will monitor themselves. But then these people's groups joined hands, 6 groups, they shook hands and formed a fund that we will monitor companies. So that's how a fund was born, and we are very pleased to have you analysts here. And then these men and women of impeccable integrity, commitment, may I ask you, all of you, to stand up. Martha from Latin America, Gina and Regina from Latin America, Joyce from Africa. Could you please stand up for a second? Edward from Francophone, Amal from the city of Sweden, Sarah from Malaysia, Gina and Regina. Yes. These men and women have come from all over the world. Few of them we are missing. They are meeting in Thailand these days to discuss on the politics of complementary feeding and complementary foods. They couldn't be with us because that meeting is so important. So these led the whole movement in the world, and now from 6 groups in 1979, I can proudly say we are more than 256 groups in 166 countries, and BPNI is one of them. This is what brought enthusiasm, the activism, the technicality, and the whole understanding of protection. Out of the protection, promotion, and support, the 3 elements which are the hallmark of this movement, and they are much needed. If you want to increase breastfeeding rates, you can't do without these 3 elements working together. So that's an important element there. In the protection side, when we started working in our country, as Raj already pointed out, the IMS Act gave us a wonderful, that's one of the best milestones we ever had. The Parliament of India gave us in 1992 to challenge the companies if they're violating, to ban the advertisements of baby foods all over the country. So that's one of the best achievements. I like that we clap for the IMS Act today. In 2003, it got further stronger. Parliament passed another amendment saying anything for the children under the age 2 cannot be promoted by anyone. Cannot be promoted. No advertisements, no promotion for any food. For example, if you manufacture even a biscuit, you can't say on the TV or on the newspaper that's meant for a child under 2. You can't. That's the protection we got. Who will benefit now? Our next generations. They are no longer seeing those bubbly babies Chirag saw in a cinema hall. They're no longer seeing those tummy babies in the advertisements. You ask a child now, they will forget those images of lactogen, Cerelac, Ferex. They don't see them. They will not question that. What is the feeding practice which is most optimum? So next generation is going to benefit. The children who are growing now, they are the most likely to be benefited by this law, with changing in the socio-culture pattern of breastfeeding will take place. So that's one thing. But another thing, be vigilant, be alert. Another milestone. I call it a milestone because we got it now. In 2005, we had a tremendous pressure from the global trade community now. WTO, if you have heard about it. Now the trade people wanted to repeal this IMS Act. And there was a proposal. IMS Act should be repealed. We were literally on the roads for 3.5 months with 26 organizations joining. Right to Food, Right to Health, professional organizations, Trained Nurses Association of India, pediatricians, activists. We were all on the streets of Delhi for 3.5 months. Finally, we succeeded. The government of India decided not to repeal. To me, that was another milestone. And we will not be surprised if we get another proposal like this. We don't hope we shouldn't get it, but we will not be surprised. The pressures of trade are before health. The trade really overpowers us. The money overpowers us in taking our decisions. 2000, along with this protection, we got another landmark milestone. Information and Broadcasting Ministry banned the advertisements through all the cable TV network. That's a huge network, which was at that time in 45 million homes, and I'm sure now it's it's more than 4 times. And you can imagine the power of media now. If there was no IMS Act, imagine what would have happened now. Imagine that. That is the beauty, that is the protection we have from IMS Act. If IMS Act was not there, media has grown 200 to 300 times. You can imagine the number of advertisements. You can imagine how it would have actually tortured the feeding practices of our families. That was another landmark which we got. And in this, there is another landmark of pressures when the Global Alliance for Improved Nutrition, a sanstha called GAIN, is a business interest organization, came to India to launch nutrition, and we all got gathered on the streets of Delhi again with the posters of Go Back Gain, and we succeeded in offsetting that what they were claiming to coordinate nutrition in India, set up a national organization on that. So we succeeded in that. So this was another milestone that public was on the streets. They sincerely worked hard to get this stopped. We don't challenge the existence, but we continue to challenge their type of action they do, which they bring in industry on the forefront. Now in the promotion front, year after year, friends, you will remember World Breastfeeding Week. 92, it's 20 years of World Breastfeeding Week now. Next year, BPNI is taking the lead in organizing the World Breastfeeding Week theme. So these are the milestones which continue to happen. In the promotion part, the training. WHO gave us 3 training courses, one on breastfeeding, another on complementary feeding, third on HIV. Now we have the 4th one on growth monitoring. So when we got the 2, we combined 2 with breastfeeding and HIV course. We developed our team of trainers. They need our team of training team led by Professor Kushwaha and Professor Freedy from Delhi. He is a professor in medical college in Delhi. And several professors of medical colleges sitting in this room. I salute you all to combine those courses into 3, called 3 in 1. Now it's on our way, will be released today. We have combined the growth monitoring into that also. Now it's a 4-in-1 training course. The unique one that the world has seen ever. That's another landmark milestone for BPNI. We've got hundreds of trainers in all over the country sitting in this room. They have trained thousands of middle-level trainers in the medical system. Tens of thousands of workers have been trained. Still it is a drop in the ocean for India. So that's where we are now working very closely with the government, and I will make a request to the government of India, both health and women and child, that in the next plan, develop a plan in which each and every worker could be trained, and BPNI would be happy to work, support, provide that infrastructure, support to the government to train all the workers of the government of India to lead this training effort. It's a massive effort, but we know it can be completed. In support, the milestones are, of course, maternity benefits, maternity leave, which the government of India has given to its employees. Certainly, it's a step in the right direction. It sets a standard. We have 2 years of child care leave for women. They can enjoy up to 18 years of their baby. That's again for central government employees. I just heard last week that Punjab has done 1 year child care leave. So states are now taking action slowly. Haryana has already done it. So the issue is, like, we need to work hard, advocate with the governments and the political parties to make this possible for every woman, whether she is at home or outside home, that 6 months, at least 6 months of leave she gets from the home work also, so that she gets time to be with the baby. If we aspire to increase exclusive breastfeeding, we must aspire that the mother and baby are together. How can it happen without them being together? So that's the aim that we should keep in mind. Next milestone I'd like to share very quickly with you is BPNI taking on the global role. In 1998, we took on coordination for South Asia and we started working all the countries of South Asia. Action has started there. In 2001, we took the role of coordinating in Asia, and that's how we learned that big steps can also be taken. And in 2004 and 5, we launched a worldwide program called World Breastfeeding Trends Initiative, which was conceptualized in the BPNI office. Now it's running, rooted in 81 countries all over the world, and we hope that by next year it will be more than 100 countries. This is a huge landmark for BPNI, and the World Breastfeeding Trends Initiative program will be presented in its totality when BPNI organizes World Conference on Breastfeeding from 6th to 9th December 2012 in Delhi. We organized the Asian Congress on Breastfeeding in 2003, in which 38 countries took part. Now we hope more than 70 to 80 countries or even 100 countries may join next year. So you all are invited. I extend my personal invitation to you all sitting in this room on 6th of December next year. So the friends, finally a few words on the impact. I can say certainly we have checked the decline. When I say we, it's not only BPNI, it's the we sitting in this room or outside this room. The governments and the non-governments, the people who work around. So we all have done it together. What we have done is that there were studies earlier from 75 to 85 to 90 breastfeeding rates were on decline. So we can claim if exclusive breastfeeding is not increasing, it's not decreasing either. That's also an achievement. We have stopped the decline. That's one of the major achievements that I would say. But we need to work hard. This is the time to push up. This is the time to promotion and support to push up. We have good protection, but we need to push this up. That's an important thing. Thousands of technical people trained. We are not just activists. It's full of science. BPNI is full of scientists, academicians, professors and head of the departments of pediatrics, gynae, nursing. All are part of BPNI. There are thousands. I don't recall how many of them could join us today. I salute once again to all of you who are here today. Certainly we have decreased the violations. We don't see any advertisements on TV or newspapers. That's a huge, huge gain for India. As I said earlier, maternity benefits. Certainly, what we are the most important thing which I think I should announce, in fact, the 12th five-year plan of the Government of India starts in April next year. In the approach paper to 12th plan, Government of India has committed that there will be a strong emphasis on breastfeeding and the community intervention. That's a huge step which probably the advocacy of all of us has led the Planning Commission to think about, and this is happening now. Plans will be made and we will probably have a huge impact once the plan has its budget, it has its targets to achieve. So we will have huge work to do at our doors, but at the same time, we show a lot of massive movement will take place during next five-year plan on breastfeeding. In the end, friends, I will not do justice if I don't get the team BPNI to show their faces. Arushi, Lubna, Nupur, Veena, please all stand up and say, Amit, Veena, Shobha, Nilima is listening, she has to see her mother, Gupta ji, Vinay, Suresh, Vijay, Ashok, Sudhir ji, Radha, Jeffy. For these committed human beings, they work all around the office and outside. I wanted to present that this is the next generation also of BPNI, which will take this to the next decades and the century, if I can say so. this issue is not going to die. This issue will live throughout our lives and beyond our lives. So this is the team which we are relying on. And this day we do miss a human being who died in a road accident, traveled with us many years, Yoginder. We do remember him. He is very much a part of our heart and team, and we are missing. Fortunately, we have his wife here. She works for BPNI. Finally, a friend who also worked occasionally with BPNI, Mr. Kumar, couldn't join us today because he got fever. He sent heartiest congratulations and a couplet about BPNI, which is so apt today. मैं अकेला ही चला था, जानिबे मंजिल मगर means towards our destination. लोग मिलते ही गए और कारवां बनता गया. Thank you so much, friends.
Thank you, Arun. And you have seen what we have done as BPNI in last 20 years. Now I remember a training course in Patiala where Dr.Arun took me and Dr. Arun and Dr. Jindal to train doctors in Patiala. And before that we have a training in Haryana. One of the young talent who was trained and during that training in Haryana was Dr. Dadhij. Dr. Dadhij is the national coordinator and he is such a hard working fellow in BPNI that without him we now cannot do much in BPNI because Arun is so much busy in international networking. So I will just request Dadhij to say what are our challenges for the future, what we are going to do in the future. Dadhij.
Now we need to film GP. Now we need to film GP.
Respected Dr. Kushwaha, Chair, Mr. Pradhan, Dr. Sri Ranjan, Dr. Anand, Dr. Arun, invited dignitaries and friends. After hearing about the milestones and achievements of last 20 years, I would like to talk about what are the challenges in front of us. Challenges to the breastfeeding as an issue and also challenges to BPNI as an organization. But before that, I would like to tell you some thoughts about mother's milk expressed by Gurudev Rabindranath Tagore while delivering a lecture in America in 1933. He said, and I quote, "The nature has designed provisions that infants be fed upon their mother's milk. They find their food and their mother at the same time. It is complete nourishment for them, body and soul. It is their first introduction to the great truth that man's true relationship with the world is that of personal love and not that of the mechanical law of possession." And quote ends here. Some 80 years after this saying, the world is still not able to ensure optimal feeding practices for some 92 million out of 136 million infants born every year. In India itself, 20 million out of 26 million babies born each year are not able to practice optimal infant feeding. And more worrisome factor is that we are not able to improve the rates of exclusive breastfeeding. Though there is, as Dr. Arun said, that they are not declining either, but they are not increasing. And this is happening in spite of adoption of international tools like global strategy for infant young child feeding a decade ago, and the national guidelines on infant young child feeding in India 8 years ago. There are several reasons for not being able to enhance the breastfeeding rates, and they remain a challenge before us and need adequate response in a comprehensive manner. And I have chosen only 4 most important challenges which are linked with the protection, promotion and support of breastfeeding. And these challenges, they have emerged from a structured assessment of the policies and programs on IYCF using the WBTI, which Dr. Arun was just mentioning. The first is the aggressive promotion of infant formulas and infant foods, and the fact that there is no effective system to deal with these violations. The second is a lack of adequate and appropriate information system which is available to the breastfeeding mothers. The third is lack of skilled support from healthcare providers, and the fourth is lack of adequate maternity entitlements. And first I come to the protection. We have already heard that we have a very effective tool in IMS Act which has effectively plugged any explicit advertisements and promotion both in electronic and print media. But subtle attempts by the industry are still on. This is happening because we have not been able to establish an effective system to monitor the violations and implement the Act. The need for this effective system, though, was realized at the time of enactment of this law, when the law was being passed in the Parliament, and then Minister of State for Women and Child Development, Ms. Mamata Banerjee, realized and said, and I quote, "I'm thinking that monitoring committees should be constituted at national and state levels. We can coordinate this committee. The government enacts a number of laws, but they are not implemented. The state government should lay more emphasis on the implementing authority," unquote. So this was the thinking at that time, but after even 20 years, we are still finding that the effective system has to be established. The second important challenge in protecting breastfeeding is to break the nexus between the healthcare system and industry. This is still happening. And this is happening in spite of a very strong letter written by Mr. Pradhan and Mr. Sikri from both the ministries. The letter went to all the chief secretaries, and also a letter was written from Ministry of Health to the professional organizations, but still this nexus is there and has to be broken. Next in the protecting breastfeeding is the challenge of increasing presence of the baby food industry in national and international decision-making processes in policies related to infant and young child feeding, and this is creating unacceptable conflicts of interest. For supporting the breastfeeding women, she needs an opportunity to be with her infant, as Dr. Arun rightly said. So it is important that this opportunity is provided to her, and which requires, if we want her to practice exclusive breastfeeding for first 6 months, she should be provided with 6 months of leave to all the women working outside or inside the home, irrespective of serving in government or private sector, both organized and unorganized. They should also be provided with adequate wage compensation during the breastfeeding period. Then every breastfeeding woman should have access to breastfeeding counseling as a service by adequately trained and skilled counselor. And as Dr. Arun said, that we have done a lot of trainings, but that is a drop in the ocean. So this training which we are releasing today has to be institutionalized, has to be